Okay, hello everyone. Welcome to Sleep in Your Health, brought to you by Northern Westchester Hospital. My name is Amy Rosenfeld. I'm the program coordinator for our Center for Healthy Living program at Northern Westchester Hospital. And I would like to introduce Dr. Praveen Rudraraju, who is our medical director for our sleep center at Northern Westchester. He is going to guide us through a conversation today all about sleep and to help us get some very much needed Z's. During our presentation, I'm going to ask for some audience participation as well. You'll see some Zoom polls pop up on your screen with some trivia questions, and we invite you, when you see them pop up, to answer and give these questions your best guess, and Dr. Praveen will give us the answers. If you have questions during the presentation, I invite you to put them in the Q&A portion of the webinar, and we will answer questions at the end. We also invite you at any time to learn about our sleep center by visiting nwh.northwell.edu/sleep center or call 914-666-1114. No referral is needed to make an appointment. So let's get started with learning about the importance of sleep, and we'll start with our first trivia question. All right, true or false? Poor sleep is associated with an increased risk of cardiovascular diseases, including stroke risk as well as weight gain. Let's see what the audience thinks, Dr. Praveen. They're going to say true or false. All right. Let's see. So our audience said true. What's the answer, Dr. Praveen?
Thank you, Amy, for arranging all of this, and thank you for the introduction. I think the audience got it correct. Hold on, I have to close, I think, the poll results. It's on my screen. So the audience got it right. So sleeping poorly can increase the risks that we talked about in that question, and it does cause numerous health problems if you sleep poorly. So if you sleep good quality and quantity, there are numerous health benefits to it. The increase in cardiovascular disease in some studies is up to 40% with poor sleep quality or less than 5 hours they studied. And if there is chronic insomnia, the stroke risk in some studies have increased by 4 times. And there are numerous studies that have linked poor sleep quality with weight gain, because there are hormones, ghrelin and leptin, that have to be in balance. And if they're not in balance with each other, which happens with a poor sleep quality, then there is a chance that you could gain the weight. And also, poor sleep quality less than 5 hours can make you feel groggy, problems with the driving, not doing so well at work, for kids not doing so well in school. So there are many other long-term problems that could happen, not only just the stroke and cardiovascular risk.
So sleep is a very important thing to be involved in our health.
Yeah.
So I'm sure the question on a lot of people's minds is, how much sleep does the average adult actually need? And let's poll the audience to see what they think first. How much sleep does the average adult need to be healthy? What does everybody think? 11 to 12 hours, 9 to 10 hours, 7 to 8 hours, or is less than 6 hours okay? Everybody, of course, will want to know what the golden number is. All right, let's see what our audience said. Our audience said most people said 7 to 8 hours. What do we think, Dr. Praveen?
All right, let me close the poll results here. All right, good. So I think most of them again got it right. 7 to 8 hours of sleep is needed for most of us. There are few long sleepers and few short sleepers. So the long sleepers would need 9-10 hours or longer. The short sleepers would need less, 5 hours or so. So the way you can figure it out is if you sleep 9 hours, 10 hours every day, and then you're normal, functioning wise, driving and all these things. But if you sleep 5 hours and they're still okay, then that means you need 5 hours. But if most of us by that strategy, need 7 to 8 hours to maintain ourselves functioning well. So that's how the number came about. 7 to 8 hours is 90% of us require 7 to 8 hours. It's only a small percentage of them are long sleepers or short sleepers. And not only the quantity, but quality of sleep is also important. So both quality and quantity, 7 to 8 hours of quantity and quality are both important for our well-being.
And what about children? Why is sleep so important for them, and how much sleep do they need?
So children is slightly different, right? So they would need a lot more than 7 to 8 hours. 7 to 8 hours is the adults. So let's say toddlers to up to 3 years of age, you need about 12 to 14 hours of sleep. And then after 3, the time slightly decreases. Up to 6, 7 years old, you can have 11, 12 hours of sleep. And then when you get to teenage years, you need about 9 hours of sleep. Like, most of the kids, it's difficult to get that much sleep because of homework and other activities, social activities that they have to do.
Okay, so since sleep is so important, we've talked about why as a big picture for health reasons it's important and how much we're supposed to be getting. I'm hoping you can give the audience some advice on how to get a good night's rest. So let's do a trivia question to see about some common sleep behavioral questions. The first one is about eating. True or false? Eating at night affects your sleep. Audience, what do you think? Does eating at night affect your sleep? All right, so looks like the majority, everyone in the audience said that it does. Dr. Praveen, how does eating affect your sleep?
Yeah, so eating at night close to bedtime is not good for sleep. So we advise usually 4 hours of time between the last time you have a meal to the bedtime, because that's how much time it takes for most people to digest the food and empty the stomach. But having said that, you can't go to sleep hungry, because you can't get a good night's sleep if you're hungry. So snacking is okay if you're hungry just before the bedtime and if you have to eat. And what can you eat in terms of snacks? You can eat small quantities, and that too, some foods are better than others. So if you have to eat close to the bedtime, it's better to stick with high tryptophan content food, like warm milk, nuts, bananas, citrus fruits, turkey, and you can find other high tryptophan content food that are good for sleep.
Such great advice. All right, so let's do a question about activities to do just before bed. What activity, audience, what do you think? What activity is good to do just before bed? Dim the light and read, work out, drink alcohol, or finish a work project? What do you think is a good idea to do just before bed? All right, and let's see what our audience says. The majority say dim the light and read. Dr. Praveen, which of these activities are good ideas to do before bed?
I think majority of the audience are correct, but I'm surprised nobody got the alcohol one right. So having said that, but all of you guys are correct. Dimming the lights and reading is it helps you fall asleep, because it's a good cue for the brain to fall asleep. So reading again on the iPad is not so great, because the light is falling on your eyes and the retina. So the better way to do that is either on a book and some light falling on the book, so that way you can see it. So that would be the better way to read. Having an iPad or other things, if you can dim enough, I think should be okay, but most of the time it's not recommended per sleep literature, because everything falls, the light falls on your retina, and that will disrupt your sleep chemicals. And the other answers we have on the list, working out is great. So working out is not a wrong answer, but the timing of it is the wrong answer there. So what we normally advise is working out earlier in the day, because there should be about 5 hours gap between the last time you work out to the time you get to bed, because there are enough active chemicals that your body generates when you are exercising and doing workout, especially a strenuous exercise. And these chemicals would not let your sleep chemicals to build up, so you won't be able to sleep. So working out earlier would solve that problem, because all the active chemicals would go down and your sleep chemicals will go up when you are ready to go to bed. So earlier workout is a good option because that'll help your sleep chemicals build up more if you work out earlier. And drinking alcohol does disturb sleep. Yes, most people have a notion that it will help them fall asleep. That's correct, because alcohol is a CNS depressant, so it'll help you fall asleep, but it won't let you stay asleep. Alcohol causes huge disruption in your sleep quality, because what it does is it suppresses your brain cells to produce these chemicals. And once the alcohol disappears, because it does decrease and disappear from your system while you're sleeping, so when that happens, all these chemicals that are built up in these cells get released, and then that wakes you up. And then you can fall back to sleep and becomes a disrupted sleep. And it's very common for people who drink every night to have these sleep disturbances because of that. And getting work done a little earlier, if you have a homework or if you have other things that for work you have to go home and do the work, then I think it's better to do it earlier and not have to do closer to the bedtime, because that'll again stimulate the active chemicals and you're not able to fall asleep.
Interesting. So many misconceptions. Really, you explained it so nicely. Thank you. The last common behavior one, a lot of people have this question. True or false, audience? Does watching TV in bed, is it a healthy way to fall asleep? What do we think? Watching TV in bed, is it a healthy way to fall asleep? Perhaps one of the most common sleep behaviors. All right, let's see what the majority of our audience says. A little more split here, but most people say false. Watching TV in bed is a healthy way to fall asleep.
Yes. So, so there is a difference. You can watch TV until the time you go to bed, but the problem is where, right? So, so watching TV in the living room is okay, or not in your bedroom, somewhere else. So you can watch TV somewhere else and then turn the TV off, go to bed. That's a better habit than watching TV in the bed. So the difference is between the two. So if you associate the bedroom only with sleep, so your brain will have a cue that as soon as you enter the bedroom, dim the lights, then you know your brain knows it's time to sleep. But if you go to bed, watch the TV, then the brain gets so confused as to when to start producing those sleep chemicals and when to sleep. So that's going to be one of the cues that you're taking away from the brain. I know you have other cues, which is the time of bed and the light and things like that. But this is an extra cue that you can give to your brain, which you're taking it away. So it's not a good habit. iPads, phone screens, it's not so good as TV because TV is farther. So that's why TV is better, because it's more than 10, 15 feet. The light is not going to stimulate the active chemicals. But the iPad and iPhones are very close to you. So those lights can stimulate the active chemicals, and it will disrupt your sleep because you're not able to generate the sleep chemicals that you require to fall asleep and stay asleep.
So it sounds like what you're saying is you want to keep your bedroom as calming a place as possible that's not stimulating. Really, if you're going to use a screen, to use a television screen that's farther away from your face, and to do calming activities before bed that allow your brain to unwind.
True.
Okay. For those people who are uncomfortable or have difficulty falling asleep, staying asleep, or perhaps have trouble waking up or consistently wake up early in the morning, what would be your advice for them?
So the first thing you have to find out is why this is happening, because then it's easy. If you find out why do you have trouble falling asleep, why do you have trouble staying asleep, and why do you wake up so early? So if you find out the reason, it's much easier, because if you correct the reason, then probably the sleep gets better. So what are some reasons that can happen? Either you have chronic insomnia due to some other medical condition, so you have to find that out, or you are not doing one of the sleep hygiene habits that we just talked about, or some other sleep hygiene habits that are good for you. So maybe just changing those will help you with the trouble falling asleep problem. And some people have mental illnesses, depression and bipolar and anxiety disorders, which can either prevent you from falling asleep or you'll wake up early in the morning. So those are the things that probably if you control those illnesses better, I think the sleep gets better automatically. And if you're waking up in the middle of the night, it could be because you have to get up multiple times to go to the bathroom, or you have snoring that's disturbing you, or is it sleep apnea, or is it low oxygen that's causing the problem, or is it restless legs that's preventing you from falling asleep, or is it periodic limb movements that are waking you up? So if you find out what the reasons are, I think it's much easier to solve the problem than just what should I do. So it's not one size fits all, but finding out the reason probably should be the first criteria. And if you can't find out the reason, then comes what to do. I think it all depends on person to person. First, you have to figure that out.
Okay, so your advice would be to speak with your general practitioner to see if there's a
Right.
first and underlying medical reason for all of these behaviors.
True.
Okay. What would you say, and now it's a good segue into talking about some sleep disorders that you see, and perhaps that's an issue for some sleep problems people have. What would you say is the most common sleep issue you treat in your practice?
So most common sleep problem we have is sleep apnea in my practice. 80% of my practice is sleep apnea. So snoring is a major symptom that brings people in. But some people may have minimal snoring and still have sleep apnea, but it could be the first sign. So everybody who snores at least should be evaluated to see if there is a sleep apnea concern. I know a lot of us snore, but sometimes snoring means sleep apnea without any other symptoms for it. It's better to find out at that time than wait and find out at a later time when it's affecting you, because eventually the sleep apnea will affect different organs in the body. So instead of waiting until that happens, if you find out earlier, maybe you can prevent what's coming. And what else can happen with sleep apnea? Because you're stopping to breathe, your airway is so narrow, that's why you're stopping to breathe. So that causes less air going into your lungs, so less oxygen. Having less oxygen to the brain, to the heart, and other organs will cause brain problems, heart problems, and other problems wherever you're not getting enough oxygen. So, and not only that, sleep apnea can cause the common health problems that many people experience with other health issues.
Okay. And if you have sleep apnea, what are some of your treatment options?
So depending on, again, how bad the apnea is. So you have to find out where you stand in the degree of apnea and how low is your oxygen going and how many minutes is the oxygen low. Once you find out how bad the apnea is, then we can figure out the treatment options. So CPAP is most commonly used for sleep apnea, and many people are aware of it because someone in the family uses the machine or the mask, or your friends use it. Because nowadays it's so common to have sleep apnea and have a CPAP machine. The machine is a small machine with a tube and a mask, and there are very small masks nowadays that you can use. You don't have to have the big face masks that years ago was the only option, but you have all these options that you can use as small mask as possible if it works. And if other options other than the CPAP in some patients would be a mouth guard, like a dental device. A dentist will make a device for you. Or there are nostril equipment that goes just in the nose without any machines. And there are other machines that pull the palate. And there are surgeries that are offered in some patients if there is a surgical problem, especially in kids. Surgery probably would be the go-to option in a lot of kids, because just by taking out the tonsils, adenoids will cure most of the sleep apnea problems in kids. So we do put that as the first option in them.
So if you're diagnosed with sleep apnea, you don't have to automatically say, I'm going to be living with a CPAP machine next to my bed for the rest of my life. There are options to discuss with your physician. Okay. What are some of the other common sleep disorders that you see in your practice? And maybe perhaps are there any specific ones you're seeing a rise in with the COVID-19 pandemic?
So yes, so insomnia is another issue where, like you mentioned before in the previous question, problem falling asleep, staying asleep, or waking up early, right? It could be because of what's happening around us now with the pandemic and the anxiety that's caused by it, either because somebody in your family got it or because of financial issues with a lot of downsizing with many companies. And all these things causing anxiety along with the current situation that's around you and the news around that's causing it. So that's mainly the concern with the adults than the kids, because we are the one that's feeling it. So with anxiety is the underlying problem, if we take it away, the insomnia gets better in most people. So when the pandemic goes away, I think the insomnia gets better. But in the meanwhile, we can still address the anxiety issues either by either cognitive behavioral therapy, meaning some relaxation techniques that the psychotherapists can help you with, taking your mind off, and so the anxiety would get better, or medication help if we need it, would be one of the major things. And with the kids, yes, anxiety is not the problem, but still they have some sleep problems because of there is no structure, especially from March, because everybody is home, everybody is going at their own time to the bed, waking at their own time to the bed. So these kids have gotten used to going to bed late. So they're going to bed midnight, waking up 10 a.m., 11 a.m. And now some schools are going back in person, or the virtual school starts earlier in the day. So now you have to fall back to sleep earlier and wake up early. So that delayed sleep phase syndrome has caused problems in some kids. So that's insomnia is one. And then other things we see is daytime sleepiness and narcolepsy-like disorders, where patients are sleepy in spite of getting good amount of sleep. They get 7 to 8 hours and they're still sleepy during the day. So narcolepsy is not the typical narcolepsy that we usually think about. Oh, he's falling asleep at the dinner table. He's falling asleep talking to me. But there is a spectrum of narcolepsy where you don't have to have the typical narcolepsy features, but I've seen a lot of them in that spectrum where diagnosis gets missed until much later because they're just sleepy and they feel that it's so normal because that's what they've been all their lives. So picking that up will help these patients. And the restless leg syndrome, like we talked about in the previous question, where you are restless, moving legs preventing you from falling asleep, or movement disorders at night, sleepwalking, sleep talking, and other behavioral related sleep disorders at night. And there are seizures. Some patients have seizures in the middle of the night. Nobody's watching them because they're sleeping. But the sleep study can pick those up because in the sleep study, we do monitor the brain activity, so you know when they have a seizure. So that can be picked up on a in-lab sleep study. You can pick that up.
So it sounds like there's a very large spectrum, if you're having trouble sleeping or staying asleep, of different disorders that could be affecting you. It transitions into what you were just alluding to before, a sleep study. If you feel like you or a member of your family might have a sleep disorder, how does a sleep study work and how could it help them?
So the sleep study is conducted overnight in a sleep lab, or you can do in a home study, which is a much basic study. If you're talking about the detailed study, that's an in-lab study. So it's a non-invasive study. So we're not putting any needles. It's only monitors on you. It's a small leads. If you ever had an EKG done, the small leads that they put on the chest, those are the similar leads that we use for the sleep study, but they go on the head to monitor different brain activities, and they still go on your body as well to look at your breathing, to look at your oxygen levels, to look at movement disorders and things like that. So everybody gets all these leads hooked up from on their body. It takes an hour to do this hooking up process. So once you get all the leads, we monitor the breathing patterns, oxygen, heart rates, and what stages you're going through, and it'll give us more insight into what's happening with your sleep in terms of your sleep stages, in terms of either what's disturbing your sleep. Is it low oxygen that's waking you up, or is it something else that's waking you up?
Okay, so it sounds like it's really the best diagnostic tool to figure it out. And again, to learn about our sleep center, the information to visit nwh.northwell.edu /sleep center. No referral is needed to make an appointment. You can call 914-666-1114. So let's take a look to see what our sleep center looks like at Northern Westchester Hospital. If I can pull up my video here. Okay. All right. Okay, so Dr. Praveen, maybe you could just walk us through what happens when you come to Northern Westchester for a sleep study?
Sure, absolutely. I don't know if other people heard the audio on that video. I couldn't hear the audio, but if any of you did not hear the audio on that video that was just presented, the first part you see is the office area where we see patients during the day. And as you enter the center, that's where we have 4 sleep study rooms. Like you saw, those are individual rooms with the bathroom in that room. And you saw the TV there, so you can watch TV before you fall asleep, which is not a great idea, but we had to do it for some people. And there is a video and audio monitoring in the room. And the technician is sitting in the room next door, so they're watching everything. So when you come in, usually most studies start at 9 o'clock at night. So 9 o'clock, you come into the study, and you'll have a 1-hour hookup process with the leads, like I explained before. And you have a 1-hour acclimatization to the center, because your brain needs to get used to where you are at, to have a good night's sleep and fall asleep. So usually study starts around 10:30, 11, and we're done by 6:30 in the morning. For pediatric studies, we tend to do them earlier. So we bring our pediatric patients by 7:30, 8 o'clock at night. And we ask one of the parents to remain in the room with the child. And there is a sofa that becomes a bed for the parents to stay at. And it's done by 6:30 in the morning. And when you wake up, you can go back to work. The leads can come off easily. There is a shower in the room. If you have to take a shower before you get to work, that can be done.
And I should mention that our sleep center has achieved the American Academy of Sleep Medicine 5-year accreditation, which basically means we've demonstrated a commitment to the highest quality of care in diagnosis and treatment of sleep disorders. And very comfortable. I've seen it. Very, very comfortable. During the COVID-19 pandemic, maybe you could explain if it's safe to come to the hospital for a sleep study and what the protocols are to keep patients safe.
Sure. So we have changed several processes for the sleep studies after the COVID pandemic started. Everybody gets a COVID test 3 days before the sleep study. So you get a sleep COVID testing. If that's negative, that's when they can come for a sleep study. And on the day of the test, they are screened by symptoms. If they have any symptoms, either that suggest COVID, or if they're not feeling well, then we reschedule the test. We don't let them do the study because it's not even good for representation of your sleep. So if you're sick, you shouldn't get a sleep study, either home or in lab. It doesn't matter because your sleep is different when you are sick. So you have to call. Can you hear me?
Okay, now you're back. You're back.
all the leads and wires that go on the patients, they are not reusable. They are disposable. Before all the pandemic, they are reusable wires and leads. But now with the pandemic, the hospital has moved towards disposable leads and wires, and they are used only on one time on these patients. And all the technicians that do the studies are wearing PPE. They wear the glove, they wear the masks to do the study. After the test is done, the rooms are terminally cleaned, just like when the patients go home from the hospital. After they're discharged, the hospital rooms are cleaned, just not the linen change, but the entire furniture gets cleaned. Same thing in the sleep center. So when the patient leaves, the linen gets changed and all the furniture gets cleaned as per protocol.
And I'm sure people are wondering if you can do this at home and what maybe the benefit is of doing it in the hospital versus doing it at home.
Sure. So the home study is a basic study. You can do the home study if your diagnosis is clear at the get-go. So when you're talking to the patient, you'll say, okay, I have sleep apnea. I just want to confirm it because I have these symptoms. So it's very suggestive of sleep apnea. Then yes, you could do a home study. But if you have any other disorders that we talked about for sleep, home study is not going to find it. Home study finds only sleep apnea and that's all. And so most of the patients, yes, you can do it because they just have to confirm the diagnosis of sleep apnea and then you can start treatment. But if you have anything else, or if you have doubts that it's not sleep apnea, it's something else, then you want to do a full study where, because with the in-lab, I can see what your brain waves are doing and what other parts of your body are going through when you're sleeping. And that benefit you cannot have in a home study. And if somebody did a home study and they didn't sleep, it's not even validated because it doesn't have the capacity to know when you're sleeping, when you're not sleeping.
Right. And if you are interested in scheduling a sleep study, again, schedule an appointment with Dr. Praveen, it's nwh.northwell.edu/sleep center or call 914-666-1114. I'm going to turn now to some of the questions when people registered had specific questions for you. So I will turn to some of our submitted questions now. Do you recommend blackout shades, sound machines, and weighted blankets, all of which have become very trendy?
Sure. So blackout shades, yes, definitely helps because if you're awake especially in summer, about 5 o'clock, all the light is coming in and you wake up early because the light is coming in, because light source is one of the cues for the brain to produce sleep wake chemicals. So as soon as the light hits you, the brain starts producing wake chemicals and it's waking you up, right? So the blackout shades will help prevent the light helping you to produce the wake chemicals. And especially people who work different hours, if you're working at night, sleeping during the day, you want to definitely make sure you have a blackout shade so that none of the lights are causing your wake chemicals to build up. Sound machines works in some patients because they want some kind of sound. So the white noise machines help these patients to fall asleep and stay asleep. TV is not a good idea because TV has although you can have the volume changes up and down at the same number because people are talking at different volumes. So that change in volume is going to wake you up and tell your brain that it start producing wake chemicals. But sound machines do produce the sound at the same level, so they are okay if you can't sleep in a quiet room. Weighted blankets, the same thing. Some people are helped by it and some not. So if it's helping you, I think weighted blankets is a good idea as well for those patients. But again, you can't generalize to everybody.
And at this time, by the way, if you have questions, please submit them in the Q&A. We will try to get to all of them. Dr. Praveen, what about sleeping medications or melatonin supplementation? What are your views on either of those?
So melatonin is good for patients who have trouble falling asleep. So if you have trouble falling asleep, or you went to Europe or any other country, and you have to sleep at a certain time, it's a good medication because it can help you fall asleep. Again, melatonin is not going to do anything to fall asleep because it's not a sleep chemical. What melatonin is doing is turning on the switch in the brain. So melatonin is one of the cues. So when you take melatonin, it turns on the switch in the brain to start producing sleep chemicals. So it'll take about 1.5 to 2 hours for your brain to start producing these chemicals. So you want to take 2 hours before your goal bedtime melatonin. So that'll help you to fall asleep. But if you have problems staying asleep or waking up early, melatonin is not going to work. In those cases, you have to decide on something else, but melatonin is not a good idea. And there are several over-the-counter medications that you can try. Some of them are Benadryl and things like that. So they are not safe in long term, but if you for occasional use, I think it's okay. Some of these non-medicinal products, valerian root, St. John's wort, those kinds of non-prescription products, they are okay to use as long as you know what's in them.
Okay. The next question, what is the effect of having your cell phone next to you while you sleep? Is it bad for you?
Yes, so cell phone, unless you are you have a job that requires that somebody call you at night and you have to answer the phone, then in those cases we can't avoid it. But if you're okay not to have phone next to you, I think putting the phone away is going to help the sleep. Because the habit is, if you wake up in the middle of the night, if the phone is right next to you, you'll look at it to see what time is it. And the phone lights are so bright, immediately it'll send signals to your brain to start producing chemicals, wake chemicals. It'll be tough to fall back to sleep. It may take half hour, 45 minutes for you to fall back to sleep just because you stimulated your brain. So yes, and if somebody texts you and that sound will wake you up, or somebody calls you by accident, that sound will wake you up. So having the phone not close by will help, unless you need it for your job or other things that you'll get a phone call for.
So to invest in a real alarm clock would be your advice. And don't use your phone as an alarm clock. Sure. Okay, the next question. Does daytime napping affect your nighttime sleep? Does it affect your circadian rhythms? Even if you're getting 7 to 8 hours, will it decrease your sleep quality? Basically, do you recommend napping during the day?
So it's a difficult question to answer because it depends on the patient. Let's take an example. If you have somebody who's a senior, in 80, 85 years of age person, now you are sleeping 4 to 5 hours at night because your total sleep time decreases with time. So you're sleeping only 4 to 5 hours at night, which is not enough. So you are getting an hour nap during the day. That's perfectly okay because overall you're getting about 6-7 hours. But on the other hand, you're getting 5 hours at night and you need 1 hour nap, and then you can't get a 1 hour nap because you're working and you can only get a 1 hour nap few days a week, then that's not a good idea because you're splitting your sleep. But if you, in those patients, we tell them to avoid naps, because if you avoid naps, then you can consolidate the sleep at night. Then you can get your 7 hours instead of getting only 5, because you took a nap, you're eating into your nighttime sleep. So naps are okay in some cases, but not okay in other cases. So when you speak with your primary care provider or a sleep provider, they will tell you if it's okay to nap in your particular case, or no, it's not okay because you're eating into your nighttime sleep. So now you have to have a nap to consolidate to 7-8 hours, which may not be feasible in most patients. And not only 7 to 8, maybe you'll get less because you take a nap. So it depends on individual person, the napping.
So it's really something to review with your physician or a specialist like you to see if it's appropriate.
Correct.
And that would that apply to children as well? Or is there, obviously young children, the recommendation is to nap. Just a follow-up question.
So young children do need naps because we need about 12 to 14 hours for toddlers to 3 years old. So for them, nap is advised to get to the total 12 to 14 because they get maybe 10, 11 hours at night. So if you catch up with this 2-hour nap or 1 hour nap during the day, at least you're increasing your total sleep time. And because for kids, the total sleep time help in their mental development and physical development. So we have to do everything that we can to get there. So nap is great with them, and we advise kids to do it to get to the total sleep time. Unlike adults, they don't eat into their nighttime sleep. Adults, we tend to eat into our nighttime sleep if we take a nap, but kids can get their full night's sleep and then can still have an hour nap, which is great.
Excellent. Next question. For light sleepers, do you have any suggestions to avoid being easily woken up?
So good sleep hygiene habits we talked about during the lecture is going to help them consolidate their sleep and do better. If they're doing anything that is not recommended, for example, alcohol, most people are light sleepers who drink alcohol. People who smoke, they tend to be light sleepers because most people smoke close to the bedtime, and then nicotine doesn't stay long in your system, so the nicotine disappears, and then you'll have all the chemicals that come up because it disappeared from your system, right? So and then you wake up. If you have any of the other sleep hygiene habits we talked about, that can make you a light sleeper. So changing those habits, maybe you'll get a better night's sleep. Some people are light sleepers because they have low oxygen levels at night, or they have sleep apnea, or they're snoring. That's make them light sleepers because it's our brain's protective mechanism. Because you're snoring, your oxygen going down, you want to maintain in a low light sleeping stage, because if you go to deep stage, maybe the oxygen will go down more and cause problems. So it'll keep them light. So if none of those problems are there, correcting that will make them into a deep sleeper. And avoiding all the disturbances for the light sleepers who don't have medical problems or sleep apnea, avoiding the disturbances and make it quiet, cool place and no lights and no disturbances with phones and people walking around. Those things will help them get a better night's sleep.
It's interesting you mentioned cool. Does the temperature of your room affect your sleep?
Yes, because to fall asleep, your body has to hit the lowest temperature. That's when you are able to fall asleep. So making the room cooler will decrease your core body temperature, will let you fall asleep sooner or better, and then stay asleep. Because when the temperature starts going up, you wake up. So, so keeping the room cool will help you fall asleep and stay asleep.
Interesting. Very interesting. Next question, it's referring back to melatonin. Is there a dose of melatonin you recommend somebody to start with, or is it age dependent or specific to individuals?
Like we mentioned with the melatonin, melatonin is not doing anything by itself, right? So melatonin is just a switch, turning the switch on in your brain to start producing chemicals. So you want to use the lowest dose possible. Most melatonin products are not, they're not, all melatonin products are not regulated by FDA. So we don't really know how much is in a tablet when they say it's 1 milligram or when they say it's 2 milligrams. So the lowest dose possible is a good idea for melatonin. So usually I tell my patients 3 milligrams is a good dose to go to. So you want to stay at 3 milligrams because even if it is not a good product, you'll have some melatonin in it. But if you tend to get a 1 milligram melatonin, that's even tough to tell how much is there. So 3 milligrams melatonin probably is the dose that I would normally recommend. The higher dose is not going to do anything, because melatonin by itself is not a sleep chemical. It's just turning this switch on. So 3 milligrams is enough to turn that switch on if it works, right? So because it works only in patients that have problem falling asleep. So if you're that particular patient that you're falling asleep problem, and if you're taking 2 to 3 hours before bedtime and not have other disturbances, because if you take melatonin and have bright lights and stimulate yourself by doing whatever, it's not going to work because it's stimulating other chemicals to build up for you to fall asleep. So once you take melatonin, you want to be calm, relaxed, do things that are calming. So you're not fighting the sleep chemicals that are going to build up in you within the next 2 to 3 hour period.
So it's not a magic pill. You still have to practice the healthy hygiene behaviors in order for it to work in conjunction
Absolutely.
with each other.
Okay. Especially with melatonin, yes.
And is melatonin safe for children?
It is safe unless you're doing it every day, because there are some reports that melatonin can affect prolactin levels. That's one of the, as you guys know, it's one of the breast related and milk related hormone. So for boys, I think it's okay to do more. For young girls, I tell them, yes, you could do it on as needed basis, but not on an everyday basis, especially for young kids. But for adults, it doesn't matter. You could do it every day. But for especially for kids when they're growing up, you could do it on an as needed basis, and it's not going to hurt you if you do it a couple times a week or so, but not every day.
Okay. Next question we have here. How long does it take for sleep deprivation to have changes on proteins of people when they restrict their sleep time daily?
So, so it's a chronic insomnia is 3 weeks or longer. So most studies, when they include insomnia into any of the studies, that's 3 weeks or longer. So to answer your questions, what we have so far is all studies that people have problems 3 weeks or longer. So if you have a 3 weeks or longer duration of poor sleep, then the studies show that that's a problem.
Okay. Next question. We have a lot of questions in the chat today. Next question. When children come to the hospital for a sleep study, does the acclimatization time for the unfamiliar equipment and atmosphere affect their sleep study more or the same as adults?
So it is usually the same as adults because they have, our technicians deal with kids all the time. So they are familiar with how to make them very comfortable. So they are coming in earlier than the adults, so you have enough time to acclimatize. We bring our kids at 7:30, 8 o'clock at night. So they have enough time to get acclimatized to the center, and the technicians are very comfortable dealing with the kids because we do cases from 18 months. So 18 months and older kids come to us, so they are used to dealing with these very young kids and how to do one-on-one. So most young kids, if you're less than 5 or 6 years old, it's one-to-one study. So meaning one technician will be with you the entire night. they're not in the room, but they are available to address to your needs because they are not addressing anybody else's needs. They are for you. So I think that helps the study get better and do better. And the parents are in the room as well. So that comforts the kids more because the parent is right next. When they wake up, the parent is right there.
Does lack of sleep increase inflammation in your body?
Yes, we see it. Many consults that come to us are sent by rheumatologists because they do the inflammation markers, which is CPK and ESR and C-reactive protein, and those are up, and they can't figure out because they did all kinds of studies to see why the body is inflamed, and they couldn't find anything else when do the study, and there is sleep apnea. So sleep apnea does, one of the things is increases inflammation and causing their rheumatologic disorder if you have it worse, or if you don't have it, just making the inflammation, and you can't figure out why the inflammation is high.
It's such a new field of medicine as well, sleep, the world of sleep, so much we still don't know, right?
Correct. Yes,
and so much
true.
we're rapidly learning.
Yes.
It's fascinating. How much deep sleep do you need?
So it's divided, the sleep is divided into stage 1, 2, 3, and REM, right? These are the 4 stages. When you're talking about deep sleep, if you're talking about stage 3 sleep, so stage 3 is only 5 to 10% of your sleep. So in a night of 6 hours, 5 to 10% is not much. So that's your stage 3 sleep. So if you meant deep stage of sleep, S3, which is stage 3, will be only 5 to 10%. But if you're including REM stage of sleep, where your brain is very active, forming the memories, dreaming, that's REM stage, that's about 20, 25%. Rest of your sleep is all stage 1 and stage 2, which is the light stage of sleep. You're spending about 55% of your sleep in that stage, a little bit longer in that stage, because the stage 1 takes about 5% or so. So 55 to the stage 2 light stage, N1 will be 5%, and the deeper stage will be 5 to 10%.
How long do you have to have insomnia before it starts to cause a medical problem?
So similar answer from the previous one, which is 3 weeks or longer is all the studies. So whatever studies you come across insomnia causing problems, all the subjects enrolled in those studies have problems for 3 weeks or longer. So anything more than that can affect immediate problems. Could be just stimulating your underlying problems. If you have a mental illness, making that worse, just the 3 weeks duration is enough. If you're talking about long-term cardiac risks, they may take longer to develop, months to years, because everybody is different. But functional status, like you working to full capacity, driving, those affect immediately. Within a few weeks, you'll see changes in the reaction time. You will see problems with those immediately.
So it looks like those are all the questions we have for today. I think this was a really insightful and engaging conversation. And Dr. Praveen, we really thank you for your time in educating our community about sleep. And that was a really good question to end on, because it shows how important sleep is for your health. In just 3 weeks, it can start to have serious consequences. And with everything going on, we all need a deep night's sleep right now. So if anyone is interested in arranging for a sleep study or to speak with Dr. Praveen, again, the number is 914-666-1114, or you can visit our website. And right after this presentation, there will be a survey that pops up automatically on your computer. It's 4 short questions. We encourage you to answer it so that we can continue to provide thoughtful and insightful programs for you from the Center for Healthy Living. And there's also an opportunity there to put your name and contact information if you would like someone from the Center for Sleep Medicine to reach out to you. We will make sure to give them that information. Of course, it is completely confidential. And we hope you enjoyed today's program, and thank you for joining us. Thank you, Dr. Praveen.
Bye.